I'll soon be a centenarian, and at this time, to learn something about that, get out of here.
And that reaction of 94-year-old Leontine Gillett to the idea of HIV education may seem logical to many. In fact, she was about 50 by the time HIV became well known.
It is in the 80s that I first saw manually somebody suffering from it, and then I got all the information from it, and that was in New York. And when I came to Belize, I realized that it was here, but it was a girl who was suffering from it.
From the 80s to the present day, Belize has been recording new cases of HIV each year. While health agencies, both governmental and non-governmental, have made great strides in being able to reduce the number of new infections and increasing knowledge, it seems that information may have skipped a key population.
We do have cases whereby we have elderlies as newly diagnosed cases.
Dr. Natalie Bruce is a medical doctor at the BFLA Primary Care Clinic.
It's estimated that currently 17% of the newly diagnosed HIV cases are found within the ages of 50 and older, and that is expected to increase by the year 2020.
These global statistics are not far off from our own numbers. It's something that concerns groups like HelpAge Belize that are working with elderly population.
I looked at the 2016 data, and I saw in 2016 there were approximately 45 new cases. And in 2017, there were 35 new cases between the ages of 50 and 65 plus. That is concerning.
Even though the over 50 age category would account for 15 to 20% of newly diagnosed infections in the last two published reports, there's no data available that tells us how or when these persons over 50 acquired the virus. It is believed that some of these cases are only detected in the later years.
Because they had never tested, you have at times whereby they might be showing symptoms, but those symptoms are not associated with, they are not thinking about HIV. They would test for something else before they test for HIV. So that would usually be the last thing that we would take into account. Here at BFLA, we try to create an integrated approach where we will offer HIV testing across the board, granted that we get the consent of the person.
In the 2017 HIV surveillance report, which is published in October 2017, this very issue is noted. The report said, the elderly do not actively seek HIV testing, so they're being detected in the late stages of HIV when they most likely present with an opportunistic infection or disease, and then are screened to rule out HIV infection. It went on to say, looking at the rate of infection in the elderly males and female population, screening opportunities similar to those in the younger age bracket should be provided.
You don't see it in marketing to encourage older person to get the HIV test done. You don't hear of older person being asked to do an HIV test. Screening should be done at all ages. And I think it's very important because the Ministry of Health statistics is showing persons 50 plus, 65 plus, positive HIV.
One barrier is the assumption that as people age, they stop having sex. Both Bulwa and Dr. Bruce agree that this is a misconception.
Back in the days, in terms of the elderly, they would be more confined to the house. But you find now that the older, you find them, they might be older, looking younger, they're taking a healthier approach to life, they're living longer, and so they're able to live a more vibrant life, and that life also entails sex.
And persons come to you and they will talk, ask you questions, and they're trying to get affirmation of certain risky behaviors that they're engaging in, and you recognize, guess what? We need to look at providing information and education.
As for the aging population itself, well, naturally, some will be more open than others.
Whoever with my age and still do it better, take a test. Yeah. Nothing wrong with that.
They had it at the Y different times, and I told Miss Lenore, Sonia, that's not for me, that's not around that. I can't even spell condom. Much more to tell you what it is used for.
And while her response may seem comical, it does show that the HIV education efforts may need to extend its reach to all populations.
The education classes that happen for the elderly are not geared towards HIV, nor HIV testing, nor prevention, because we're assuming that they already know, or we're assuming that we do not need to target them because they're not having sex. The statistics is showing that work needs to be done. And if it's estimated that there will be that increase, then we need to make sure that we're targeting everybody in terms of that nobody gets left behind.